everybody, and welcome back to my channel. I am Madison Kleckler, the fitness doula, and today we are going to talk about perineal stretching and massage. Studies have shown that perineal stretching and massage can reduce your risk of tearing during a vaginal birth. So I'm going to walk you through today what exactly the anatomy is, why we want to stretch the perineum, and how to do that effectively. First, let's talk your anatomy. Here is the bottom of your bottom, your pelvic floor in my pelvic floor model. So this is the opening to your vagina, and as your baby crowns, it is going to stretch here in this perineum area. So perineum is right between the vagina and the anus. And what is going to happen is it's going to cause these muscles and surrounding tissues to stretch. So the point of perineal massage and stretching is to kind of prepare these tissues and these muscles for doing all of that stretching. Here's how you're going to do it. Of course, make sure that you have clean hands, so wash your hands, and you can use some sort of lubrication. You want it to be very natural. Coconut oil, some use evening primrose oil, but make sure that you speak to your provider about that before inserting anything like that into your vagina. Okay, so let's imagine that this kid's cup lid is the opening of your vagina. Now, you're going to hook one thumb or two thumbs, depending on what feels good and what fits, into the opening of your vagina, and then you're going to gently pull down on that tissue into the perineum. Now, of course, you're not going to be pulling up on the top of your vagina at all. I'm just doing this to hold on to this kid's cup lid. So you're going to pull down and you're going to hold this for a minute or two. Now, you don't want this to be painful. You want to hold just enough to stretch. It may burn a little bit, but it should not be super painful. And then after that, you may be able to insert both thumbs in there, you or your partner, because we all know how hard it is to reach down there when you're pregnant. But for the purposes of this, I'm just going to use one thumb. So after you stretch down, you're going to kind of do this sweeping motion around the side and the top of your vaginal opening. So stretching down and then around and up, down and around and up, like you're trying to get some of that cookie batter off, or the cake batter off of the side of the bowl. Yeah. So down and then around. Now you can do this with one or both thumbs, so one-sided or double-sided. Now I find that with a lot of people who have vaginal pain on one side, that one-sided release really does help. So that is the basics of how you do perineal massage and stretching. Now you're going to want to be in a comfortable position when you do this, and also be sure to relax your glutes. Tension in the glutes will cause tension in the pelvic floor. You can also do this with something called a vaginal wand. I'll link it below. It might help you get into those areas. It's also great for trigger point release of the pelvic floor. And you also want to add some pelvic opening stretches, some releases on your birth ball. I have a great video back in my YouTube history. I will also link that below. Now you can start perineal stretching and massage around week 34, and you should be doing this 1 to 5 times a week, depending on how it feels for you and what you have the time and availability for. If you have any questions, please drop them below. I am happy to answer them. Thank you for being here. Make sure that you subscribe, click the bell, and like this video if you like this content. I'll see you soon.